Hey guys, this is Dr. Jeff from Whole Body Health, and today what I'm going to do is we're going to show you how to do some Gua Sha technique work on somebody who's having lower leg, ankle, or foot issues. What we want to do is when we're assessing this, we want to determine exactly where the pain areas are, and then if there are any contributors to that pain from upstream, especially if they're having pain in the foot or the heel. You always want to kind of go upstream and see if there's any discomfort up there as well. If they're having foot and ankle pain, there's almost always an uphill contributor to that. If you have somebody who's sprained their ankle recently, most of what needs to be worked on is out here, but you're going to want to work very carefully along the front of that leg as well, because you've got a big shin bone right here, and if you rub against that shin bone, you're going to tear that skin up, and they're not going to be very happy about that. And I don't do much work on the top of the foot, okay? Most of the work that I'm going to do is going to be the bottom of the foot, the inside and outside part of the lower leg, the kind of lateral part of the front part of the leg, and then I'll do calves, which we've shown you in another video of how to work on a knee. And we'll do a little bit here today. And so let's get started. You always want to use some kind of lubricant. This is a little bit of oil, and then you have to have your Gua Sha tool. There's a lot of different tools out there. We have a video just talking about how to find the tools, which ones to pick, etc. But what I'm going to do with Julianne, who's my assistant today, she has a little bit of a fallen arch. She has some foot pronation. And she's a cheerleader. And so there's a lot of pounding on those feet and lower legs. And so we want to make sure that we work on that, all right? And so I'm just going to apply some oil to the leg and just make sure it's slightly lubricated. And I'm going to move towards the ankle first. I want to stay off that malleolus, okay, which is a bone of the ankle. I'm not going to come down here and bang into that thing because it's going to be really uncomfortable. You can't see her face right now, but she's making a horrible face as I was demonstrating that. And then I'm going to move up away. One of the things that I have to be careful with women is they shave their legs, so I want to make sure I'm lubricated. I want to really wash that tissue, because when you're moving away or against the grain of that hair follicle, it can actually create some irritation as well. So I'm gonna watch that as well. That's something I'll have to watch in some other places. And so as I move down, right around the back part of that ankle, there's a little bit of the crunch sensation or gristle or sand, whatever you want to call it. And so I'm just gonna move in that one little area, and it's buttoned up right against that bone, so I'm gonna be super careful. And I'm gonna stay with that until it releases. I'll keep my finger or my thumb right on the tibia. And so I'm just gonna feel it, and just to keep me off of that. I don't wanna do a lot of scraping. And I'll flip over to the smaller edge, and right in here, there's a lot of discomfort. And it actually feels a little more crunchy when I move towards her knee. So I'm gonna scrape that. Is that painful?
Yeah.
So she says she doesn't like it too much, so I'm gonna take a little bit of the pressure off. And now it's starting to relieve it. Is it starting to feel better? So she's not getting near as much discomfort. As well as I'm gonna come into the inside of that foot. Now the bottom of the foot's one of those crazy areas because so many people are very, very ticklish. And if you get the wrong kind of pressure, it's either gonna be extremely painful or very ticklish. I don't have any discomfort like that as far as tickle, but it can be very tender because I stand on my feet all day. And I do a lot of this work on myself, both on my legs and my foot, because I had a lot of ankle injuries back in the day. So I'm just gonna kind of show you where I'm doing. I like to pull the toes back a little bit, and I'm just gonna move on the foot going towards the toes and away from the toes. And so that's what I'm doing on this side over here. I'm gonna move towards the toes and away from the toes, and a lot more. You can almost hear the crunchiness as I move from the toes to the heel. Julianne's making some really horrible faces. I'm not pushing hard at all. And so I just want to be very sensitive to how uncomfortable that is to her. And I'm going to continue to work this until it eases up discomfort and crunch. And it's actually starting to already subside as far as the amount of popping and crunching that's going on under the scrape when I do it. I mean, you can literally hear how crunchy this is. It's kind of crazy. All right. So as I do it now, is it still as tender as it was?
And the outlet right there.
Okay. So one of the things on this is something I would do on a daily basis, or have her do on a daily basis, instead of trying to get it all to fix in one day, like get maximum release in one day. You can get really inflamed in this area too, so you got to be careful with that. One of the things that I would do with Julianne is I would actually recommend, which I have in the past, recommend that she get some calf guards, or excuse me, calf sleeves. And the calf sleeves are like their compression sleeve that goes from the ankle up the shin, especially because she's doing a lot of cheers. So I'd have her wear that during practice. I'd have her, if she was running or jogging or playing sports, I'd have her do that as well. While she's doing those activities, I think uniform code won't allow her to wear that while she's cheering, but she could do it in practice and other times, just to support the stability and ligament between those two bones and taking a lot of the pressure off that leg. Let's go ahead and flip her over, and I'll show you what to do on the back of that leg. All right, so we got Julianne turned over, and what I'm gonna focus on, we can focus on the entire calf. And so we can work the entire calf, and I'll check both sides. On the upper, there's a little bit of gristle right there. You can see her jerking around. And like I said, I'm not pushing super hard. So I'm gonna do just a little bit of scraping towards the knee. If they start jumping all over the place, you can back off your pressure. You don't have to continue to go hard. And this is something you can do for yourself without a problem. And then I'm gonna work the bottom half or bottom third of this. I always wanna check that heel cord or that Achilles tendon. This is an area that we get a lot of tension in from activities and just from sitting around. And so I'm gonna put just a little bit of lubricant here. She's having a lot of anxiety about me doing this. So I'm gonna be really conscientious of that. So I'm gonna move towards the heel. There's not a lot of gristle or crunch. And I'm gonna move away from the heel, and there's some right here. And of course, she's very expressive, so she's making some faces. And I can work all the way up to where that Achilles tendon attaches into the bone, but that's going to be, if somebody has a tendonitis, it can be really very sore. I've got a couple patients, they have a ridge there, a raised up area where those two, that comes in, so they have Achilles tendonitis, and so I got to be super careful on what I do with that. Somebody who's having these problems, you'll want to make sure that you're getting plenty of stretches going on. We have a stretch for Pnf stretching of the calves. You want to make sure you're working that bottom of the foot, getting the right support in your shoes. If you need to, get some inserts in your shoes, and make sure you're getting your ankles and your feet adjusted. It can make a huge difference. And out of all the things that I do to adjust people, that's always the most surprising to them. We have tons of bones in the ankles and the foot, and they can get locked up either to tension from the way our shoes fit, from the muscle tension, or just from beating them up. And so we want to make sure that we get all those joints in the foot and ankles moving properly. So make sure you're getting adjusted regularly in those feet if they're bothering you, because that's going to be a big part of the healing process. Be sure to check the links below in the description, like us, and we'll look forward to seeing you in the future.